Now we can stand together and pave the way.
To expostulate this in the village where his sickness was rare and heavily bad. Scientist solutions, academic conclusions might find the roots of what they thought was a curse through their research. Keep up with them as they dig deep to the lineage.
In a small locality in Cameroon, we investigated a large family with an inherited genetic condition known as Fragile X syndrome. Fragile X syndrome is the most common genetic cause of intellectual disability and autism spectrum disorder. It can manifest in individuals with intellectual disability and characteristic dysmorphic features like large ears, large testes, and long faces. Identifying Fragile X syndrome and the long-standing history of intellectual disability in this rural community has led to multiple explanations for the condition, mainly a curse.
Nous avons aussi trouvé ces enfants aliénés comme ça. On parlait de malédiction, que c'est ce qu'on avait fait, qu'il y avait un aïeul qui était à la chefferie et que quand il est mort, les femmes de la chefferie sont parties au champ. C'est ce qui a poussé à ce que leurs enfants soient aussi comme ça.
Selon ce que aussi j'ai entendu, on raconte de l'aliénation de la chefferie, que c'est parce que les femmes du chef avaient maltraité l'aliéné que le chef avait à la chefferie et que ce n'était pas l'enfant du chef. Pourquoi le père avait maudit sa famille?
This explanation for the cause of intellectual disability in the village has been passed on from generation to generation. One affected family member refused to accept the curse explanation and decided to seek medical expertise.
Nous avons reçu cette dame qui venait de Bamenda, adressée par un aîné, gynécologue à l'hôpital général, et qui m'a appelé, m'a dit oui, j'ai ma fille qui a ses enfants qui ont un problème neurologique. Est-ce que tu peux avoir de la disponibilité pour les voir? Et très rapidement, j'ai organisé un rendez-vous dans la semaine et j'ai reçu cette dame avec ses deux garçons qui présentaient un retard psychomoteur évident avec des signes dysmorphiques. Et des signes dysmorphiques qui nous ont fait penser à un syndrome de X fragile, notamment la macro-orchidie, notamment les grandes oreilles décollées, faciès particuliers, et des troubles, une hyperactivité importante, des troubles du comportement très importants.
For this project, this is a family that was initially saw by Professor Serafin. In fact, this family, Fragile X syndrome in the western part of Cameroon, molecularly diagnosed by our service, and because of the exceptional big number of children suffering from this condition that is associated with mental retardation called Fragile X syndrome, because of the fabulous history and the legend of curse in that specific family that we personally witnessed while seeing the very first patient, actually the mother of the first two children that we saw, the project developed around this context.
After establishing a trusting relationship with the community, 10 males of whole blood was collected from affected families and shipped to the University of Cape Town for DNA extraction, and the diagnosis of Fragile X syndrome was done at the Grutus Crew Hospital in Cape Town. Then, a pedigree was drawn for this family.
Fragile X syndrome mostly affects boys, although not always, because the gene lies on the X chromosome and boys only have one copy of that chromosome. So most of the time, the patients that we test are males. It is not exclusive though, there are affected females and it all depends on the actual specific qualities of the mutation that is found. We normally test the boys, and if we find the variant, we would test the moms for carrier status. That means that in many instances, women are carriers of the disorder, but they don't have it themselves.
In this village, the cause of intellectual disability is misunderstood and has led to a stigma-power relationship between community members and the affected families.
Très à l'aise dans la relation. Bon, j'ai été obligée d'interrompre. Après, maintenant, dans les conversations qui passaient de gauche à droite, on racontait comment on lui disait que toi aussi, tu veux même te marier, tu vas dans une famille qui accouche les ruraux. Tu t'attends à quoi? Les enfants qu'elles accouchent là sont des enfants à charge toute la vie. Donc du coup, je me dis que logiquement, s'il traînait même, s'il faisait certaines choses, c'est parce que les on dit, donc ça fait que le mariage s'est arrêté. Pas seulement ça, même maintenant, les gens qui connaissent l'histoire, quand ils t'approchent et que tu refuses et que tu crames même quoi, c'est même pour vous faire plaisir. Vous-même qui accouchez les peut-être vous-même, vous n'êtes même pas bien, vous-même dans vos têtes là. L'inquiétude que je peux avoir, c'est juste au niveau de ces tantes qui sont obligées d'avoir des enfants à charge toute la vie. Donc, c'est assez difficile parce que quand un enfant naît, il grandit, il devient autonome. Et généralement, même quand un enfant devient autonome, c'est lui qui aide ses parents. Donc, les tantes qui ont ce genre d'enfants sont obligées de prendre charge des enfants toute la vie, quoi. Ça devient... Elle a besoin de soutien. La famille doit être là.
Experts in genetic counseling argue that detecting a carrier status early will increase the therapeutic options and promote acceptance.
The sooner we receive a medical diagnosis, the sooner we can actually intervene. And in the case of Fragile X, it's particularly important to get an early diagnosis, as lots can be done for that child in order to make sure we have the best outcome for the child and the family. With Fragile X in particular, there has been reports of extremely late diagnosis, up to 3 or more years, which means that the child has already missed 1 or 2 years of pertinent, like very important medical intervention, which could improve their life.
Once you actually have a molecular confirmation of something, it brings the end to that. So there's an economical component to it, obviously, but also the psychological component, knowing what is wrong, and then being able to focus on moving forward with this instead of being stuck in that sort of uncertainty and looking for reasons for what's wrong with my child. Is it something that I did? Is it because I fell down? Is it because I went on that boat trip when I was pregnant? All those sorts of things.
Returning results to genomic research participants is a sign of respect and response that our engagement with the participant has been proper.
So one of the things that is really important for us is to make sure that the people who are donating their samples into the genomic research get something in return, right? That their effort is recognized, especially if it's easy for us to address what they need. And one thing that we found in our research is that the people, especially people who have historically been excluded from information, right? They might not have received loads of education, they're excluded from the knowledge economy, they're excluded from the economy. These people tend to really have a thirst for knowledge. People want knowledge, they want to be explained what the research is about, but they also want to receive information that empowers them to actually take care of their own health better. And this is something that our research directly responds to. So genomic research helps us to help people think about their future health better, right? It empowers them to take better care of their future health. And for me, the return of results is one way in which we empower people who might not have lots of knowledge about their future health or about their family health to actually live better lives.
Many years we've been looking for answers. We went and consulted the elders. They told us the stories of legends and heralds of way back in the ages. But looking back through the pages, many tales, no traces. Fragile X cases. We gotta solve this equation. Cause how long has it been? We've been carrying the stigma and guilt. It's time to break free from the past embedded within. Medical genius, they turned it around, now they're healing us from all the conflicted lived experience. The cure is in everyone's DNA. Look, a new world is rising. Every day we're learning and thriving. African minds together united. To the cause, we're looking for answers. We're solving all the mysteries. Science and medicine is the key. We're looking at our DNA. Together united, we're finding a way. Cause everyone has a right to live without any disabilities. Our strength is our resilience. We stand to make a difference. From the villages to the lands, we're testing and gathering facts. Slowly we're bridging the gap. We're finding a cure to the past.